So a very good morning to you all. Good evening to those joining from Fiji, across the Pacific and beyond. My name is Sharon Levula. I am the JEDSI officer for the Pacific Insurance and Climate Adaptation Program, and I will be your moderator for today. So thank you for joining today's webinar, where we will explore findings from a disability needs assessment conducted across 3 countries, Fiji, Tonga, and Solomon Islands. And this was conducted under the Pacific Insurance and Climate Adaptation Program. So this session will dive into exploring how PWDs access parametric insurance, what are the perceptions of parametric insurance, some of the barriers that they face, and practical steps to strengthen inclusive outreach to ensure that climate and disaster risk finance and insurance solutions are accessible and works for all. So we've got a fantastic line of speakers today who will be sharing from their perspectives and their experiences, having worked in the disability space or having worked at the intersectionality of disability, gender, and social inclusion. And just to note, the chat box is open, so if you have any questions throughout the webinar, please feel free to pop that in the chat box. Our live caption function is also enabled should you need to use it, and this session will be recorded. So without taking too much time, I would like to officially welcome Ms. Senior Buri to provide the open and welcoming remarks. Senior leads the Climate Risk Finance Solutions team at the Munich Climate Insurance Initiative, which is a non-profit think tank hosted at the UN University Institute for Environment and Human Security. She's working on facilitating the introduction of innovative CDRFI for the most vulnerable, as well as building the evidence base and closing existing knowledge gaps for implementing inclusive CDRFI solutions. Senior, over to you for the welcome and opening remarks. Thanks.
Thank you very much, Sharon, and very warm welcome to all of you, to all of you participants and my co-speakers. Thank you for your interest in joining today's webinar and to talk with us to make sure how parametric climate risk insurance solutions can really be made truly inclusive and responsive to the needs for persons with disabilities. I want to start quickly with an introduction of the Pacific Insurance and Climate Adaptation Program, short PCAP. Many of you know, but so this webinar and also the assessment that we're talking about today are organized under this program. So PCAP was designed to improve the financial preparedness and resilience of Pacific households, communities, small businesses, organizations, and also governments towards the economic impacts of climate change-induced disasters or impacts. So how we're doing this is through the development and deployment of the first ever market-based parametric meso and micro insurance products in the Pacific. Since its inception in 2021, PCAP has facilitated already now the introduction of first climate risk micro insurance products across the Pacific. First in Fiji, and then in Vanuatu, but also now in Tonga, Samoa, Papua New Guinea, the Solomon Islands, Kiribati, and Tuvalu. So the program is jointly implemented by the United Nations Capital Development Fund, UNCDF, as the convening agency, as well as the United Nations Development Program, UNDP, and the United Nations University Institute for Environment and Human Security that I'm part of. So we're jointly implementing this and we're receiving financial support and are supported from our donors, governments of New Zealand, Australia, Luxembourg, the United Kingdom's Foreign Commonwealth and Development Office, as well as the Asian Development Bank. So thank you very much for the support to all of our donors. Parametric insurance, just as a quick introduction, compared to traditional insurance, allows basically payouts based on predefined parameters such as wind speed or amounts of rainfall to the insurance policyholders. That allows fast, transparent, and also convenient digital payments within days of following extreme weather events. Facilitating the development and implementation of these inclusive climate risk insurance solutions is really at the heart of PCAP's approach. This means solutions implementing them in a way that are accessible, affordable, and also relevant to the needs of vulnerable communities, communities vulnerable to climate change. Persons with disabilities form an important part of those communities, and we're very happy to share that today under PCAP already with the existing solutions, more than 2,700 persons with disabilities have been registered and receive insurance coverage. 50% of those are women. And also first payouts have been made following extreme weather to more than 260 persons with disabilities across the program as well. But this is really only the start, and we're coming today together because we want to develop more bespoke solutions that cater better to the specific needs of persons with disabilities. And that's why we conducted these assessments across Fiji, Tonga, and the Solomon Islands as the PCAP team. And through this webinar today, we want to share with you the key first findings from these assessments and discuss what really makes these solutions accessible and affordable for persons with disabilities. Lastly, also to explore what are concrete steps toward disability inclusive disaster risk financing. And with that, I hand over to Sharon and really hope you can all engage with us in an interesting discussion later.
Thank you, Senia, for setting the stage and for providing a brief background on the work that PCAP is doing. And now it is my privilege to introduce our keynote speaker for today, Ms. Rosia B. Rosia currently serves as the National Coordinator for Social Protection Reforms at the Ministry of Women, Children and Social Protection. She has over 2 decades of work experience in social development and information systems in Fiji. Her work focuses on advancing policies and strengthening gender and shock-responsive, inclusive social protection systems. Ms. Rosia, the floor is yours. Thank you.
Thank you, Sharon. Good morning, Bula Vinaka, and warm Pacific greetings to everyone joining us today. It is a privilege to deliver remarks at this important webinar on disability responsive parametric insurance in the Pacific. As Pacific Island countries, we live with constant reality of climate risk. We all know cyclones, floods, droughts, and rising sea levels continue to affect our communities, our economies, and our development pathways. Just in the last few weeks, Fiji has experienced the impact of Cyclone Urmil and associated adverse weather conditions that brought a lot of rain and flooding in parts of the country. Some communities had to move to evacuation centers. Schools were closed for a day in Central and Northern divisions and about 2 to 3 days in Western division. Some immediate support were provided by some agencies, while assessments are in progress for some places. Even some social protection beneficiaries covered under the pilot parametric insurance project are asking whether they qualify for a payout if triggers are met. So we all have experiences or understand the impact of disasters, and everyone gets affected in some ways. However, disasters do not affect everyone equally. Persons with disabilities are often among the most affected, facing barriers in evacuation, access to information, services, and recovery support. In Fiji, for example, last census data shows about 13 to 14% of the population live in some form of disability, yet they still face structural barriers. For climate vulnerable regions like Pacific, innovative financing mechanisms are becoming increasingly important. Parametric insurance is one such tool designed to provide rapid payouts following disasters based on predetermined triggers such as wind speed, rainfall, or even earthquake magnitude. These mechanisms can help government and communities respond faster and recover more effectively. However, as we advance these innovations, we must ask an important question. Are these systems truly inclusive? If climate risk financing mechanisms are not intentionally designed to consider disability inclusion, then there is a risk of some of our most vulnerable members of the community who could be left behind. And in the Pacific, we often speak about our shared commitment to leaving no one behind. The commitment must extend to how we design disaster risk financing systems. Disability inclusion should be embedded in the entire process, from data collection and policy design and right up to payout mechanisms, and ensuring accessible support for persons with disability and their caregivers. Fiji, like many Pacific countries, is strengthening policies and social protection systems to ensure persons with disabilities are recognized as active participants and right holders, not merely recipients of benefits or assistance. The revised Fiji Disability Policy 2025 to 2035 marks a decisive shift from recognizing rights to realizing them. It prioritizes accessibility, inclusive education, rehabilitation, economic empowerment, and protection for persons with disabilities, including psychosocial and intellectual disabilities. Our collective challenge now is to ensure that emerging tools such as parametric insurance also reflect these principles of inclusion and equity. So aligned to Fiji's adaptive social protection strategy, Ministry of Women, Children and Social Protection in Fiji have partnered with Reserve Bank of Fiji, insurance companies, UNDP and UNCDF to pilot parametric insurance program for about 4,100 beneficiaries. These are selected beneficiaries from main programs like namely Disability Allowance Scheme, Social Pension Scheme, Family Assistance Scheme and Care and Protection Program. Now, this inclusive selection criteria ensures that most vulnerable, including women, children, older persons, and persons with disabilities, are able to equally access this support, even if it is at a pilot stage. An impact assessment is also underway by researchers and supported by the Reserve Bank of Fiji. We hope the outcome of this report will guide us to strengthen this program. Now, just to highlight some of the challenges at these initial stages, in terms of targeting criteria, to select a small number for pilot project in comparison to the 108,000 plus social protection beneficiaries. Also addressing the concerns of those that do not get selected and the different products that they are covered for. One is only for rainfall and the other one is for both rainfall and wind speed. And how do we scale up? And the sustainability question also comes in play. So today's webinar provides a valuable opportunity to bring together policymakers, development partners, insurers, disability advocates to explore how we can design climate risk financing solutions that are inclusive, responsive, and equitable. So let us use this platform to exchange knowledge, share lessons, and move forward together in building a more resilient and inclusive Pacific where no one is left behind, even in disaster preparedness, response, and recovery. On behalf of the executives and team, Ministry of Women, Children and Social Protection, Fiji, I thank the organizers of this webinar for this opportunity to deliver the remarks, and I look forward to a rich and engaging discussions. Thank you.
Thank you, Rosia, for your keynote and for highlighting that, yes, indeed, everyone faces climate-related disasters, but persons with disabilities face compounded impacts. And the role of climate risk insurance solutions, such as parametric insurance, is key to providing that sort of safety net for social welfare recipients, especially because many of the social welfare recipients are persons with disabilities. So thank you for that keynote. We will now move on to the core of today's webinar, which is the findings from the Disability Needs Assessment conducted in Fiji, Tonga, and Solomon Islands. And it is my pleasure to introduce and invite Dr. Stella Shumba to present the key findings. Dr. Stella is a senior researcher at the UN University Institute for Environment and Human Security, working within MCII. Her work sits at the intersection of climate adaptation and disaster risk finance and insurance, with a strong focus on gender equality, disability, and social inclusion. She co-chairs the Risk Financing and Anticipatory Action Technical Working Group of the Anticipation Hub and is also coordinating lead author for the Africa chapter of the Intergovernmental Panel on Climate Change 7th Assessment Report. She also holds a PhD in Development Studies from Massey University in New Zealand. Dr. Stella, over to you for the presentation. Thank you.
Thank you, Sharon. Good morning, good afternoon, and good evening, depending on where you are. I will begin by outlining the objectives of the assessment before moving on to the key findings. So firstly, as highlighted in the keynote address, the Pacific is highly prone to disasters, yet their impacts are not experienced equally. Particularly, persons with disabilities often face compounded risks driven by multiple layers of exclusion. And so this assessment was designed to better understand how disasters affect persons with disabilities in 3 Pacific Island countries that have really been named: Fiji, Tonga, and the Solomon Islands. And so specifically, we sought to understand the disaster risks, barriers, and recovery challenges faced by persons with disabilities. And we also aim to identify the practical needs and priorities of persons with disabilities in disaster situations. And then we examined the accessibility and affordability of parametric insurance as a potential financial protection mechanism. As earlier mentioned, parametric insurance is increasingly being explored in the Pacific as a way to provide rapid financial support after disasters, but there is still limited evidence on whether these mechanisms are accessible to persons with disabilities. Next slide, please. So the assessment was informed by a qualitative research design, which allowed us to capture the lived experiences and perspectives of persons with disabilities across the 3 countries. In total, we conducted 37 in-depth interviews with persons with disabilities across Fiji, Tonga, and the Solomon Islands. And in addition, we conducted 2 focus group discussions, one in Fiji and one in Tonga, with a total of 14 participants across both groups. And then we also conducted 1 key informant interview in Tonga, which helped provide additional institutional and contextual insights. And overall, this gave us a total reach of 52 participants across the assessment. And across the 3 countries, the assessment included participants with a range of different types of disabilities, including physical, visual, psychosocial, and language-related impairments. And the qualitative data collected were analyzed thematically using MaxQDA, and the findings that follow are presented based on the key themes that emerged across the 3 countries. Next slide, please. So the first key finding from the assessment is what we describe as a low awareness but high willingness. So across the 3 countries, participants had very limited understanding of parametric insurance. Many did not know how this insurance works, and in several cases, the concept was confused with savings. And this quote from a participant in the Solomon Islands captures that gap very clearly. However, once the concept of parametric insurance was explained, particularly the idea of receiving rapid financial support after a disaster, participants showed interest in enrolling. So what this tells us is that low uptake among persons with disabilities should not immediately be interpreted as a lack of demand. Rather, it could reflect information and access barriers. Next slide. And so building on the previous slide, the second key finding relates to affordability, which emerged as one of the most important factors influencing whether persons with disabilities would be able to participate in insurance schemes. So many of the participants reported having unstable or very limited incomes, and some are dependent on social assistance or informal sources of income. So as illustrated in the quotes on the slide, some participants described living day by day, meaning that whatever income they receive is often spent immediately on basic household needs. And in such circumstances, even relatively modest insurance premiums can be difficult to afford. And because of this financial instability, participants also suggested that flexible payment structures could make insurance products more accessible. For example, some participants indicated a preference for paying premiums in installments rather than as a lump sum, which would better match their income patterns. Next slide, please. So while affordability determines whether people can enroll in insurance, another issue that came through very strongly in the interviews was what happens after a disaster occurs, specifically how quickly support reaches people, affected households. So participants across the 3 countries reported that government assistance often arrives too late to meet urgent needs. As the first quote illustrates, that it might take up to a month before assistance reaches affected households. And so during that waiting period, families are often left without food, safe water, or other basic necessities, which can make the immediate aftermath of disasters extremely difficult. So this is why the speed of payouts emerges as one of the most valued features of parametric insurance. So participants repeatedly emphasize that quick access to cash would allow them to purchase essential items immediately, such as food, water, medicines, or temporary supplies needed to stabilize their households. Fast payouts would also reduce the need for them to borrow money or sell assets or rely heavily on informal support networks, which can further deepen financial vulnerability. Next slide. So the fourth key finding reinforces the idea that basic survival needs are the immediate priority for persons with disabilities after a disaster. So participants described a clear sequence of needs, what we call here the hierarchy of needs. So they consistently explain that if they receive financial support, the first priority would be food and safe drinking water. And once immediate survival needs are secured, the next priority will be disability-specific needs. And this includes items such as assistive devices or mobility aids, like crutches, wheelchairs, or canes, which can be extremely difficult to replace after disasters. And after that, participants mentioned housing-related expenses, such as repairing damaged homes or paying rent for temporary accommodation. And finally, if resources allow, some participants explain that they would use remaining funds to restore livelihoods, such as restarting small businesses or agricultural activities, which is essential for regaining financial independence. But what this finding highlights is that insurance alone cannot address the range of recovery needs, that insurance payouts are most likely to be used to cover immediate survival needs, while longer term recovery requires additional layers of financial protection and support mechanisms. Next slide, please. And so beyond economic barriers, evacuation barriers emerged as one of the most significant factors amplifying disaster risk for persons with disabilities. So many participants explain that evacuation centers are often physically inaccessible, particularly for individuals who use wheelchairs or have mobility impairments. In some cases, shelters are simply not designed to accommodate different types of disabilities, which means that evacuation itself becomes extremely difficult. Another issue raised repeatedly was the lack of clear communication and disaster planning. Some participants reported that they were not informed about evacuation procedures or where evacuation centers were located, leaving them to rely on guesswork or follow others during emergencies. And the quote on the slide illustrates this confusion very clearly. And transport was also identified as a major challenge. So many persons with disabilities depend on family members or neighbors to help them evacuate. But if those people are unavailable or unaware of their situation, individuals may end up remaining at home when it is not safe to do so. And this challenge was also compounded by the lack of systematic mapping of where persons with disabilities live. So without this information, emergency responders and local authorities often do not know who needs assistance or where they are located, which can lead to delays or failures in evacuation support. I mean, taken together, what this shows is that while financial protection mechanisms can support recovery, they could not compensate for other forms of exclusion, as will be explored more in the coming slides. Next slide, please. Thank you. And so building on the previous slide, participants reported that existing communication systems are not fully accessible for all disability groups, which creates significant gaps in preparedness and response. Different impairments require different communication channels. For example, participants who are blind or have low vision often rely heavily on radio broadcasts, while deaf participants may depend on interpreters or other people around them to relay information. As the quotes on the slide illustrate, this reliance can limit their ability to receive information independently. So while digital platforms and social media have been helpful for some participants. They were not reliable for everyone. During disasters, electricity outages and poor connectivity can make internet-based communication inaccessible, which means that people cannot depend solely on these channels. And participants emphasize that when connectivity fails, more traditional channels like radio become extremely important, especially in remote or rural areas. Next slide, please. So bringing together the layers of vulnerability we have discussed, another important issue that emerged from the assessment is trust in insurance systems. So some participants who had already heard or had that would heard about or had indirect experience with parametric insurance had raised concerns about how triggers are defined. Specifically, they worried that the technical thresholds can sometimes exclude some households that suffer significant losses, as the quote on the slide illustrates, because the participant explained that disasters such as cyclones often affect large surrounding areas and not only the eye, what they call the eye of the cyclone. And the fear is that if the trigger is defined too narrowly, some households that experience real damage may not qualify for payouts. So when this happens, people perceive the system as unfair, which can reduce trust and ultimately discourage participation. Next slide. And the final thematic finding reinforces an important point, that insurance payouts alone are not enough to address the full range of needs faced by persons with disabilities during disasters. So participants repeatedly emphasized that their needs extend well beyond financial compensation. So many participants highlighted the importance of accessible evacuation centers, assistive devices, rehabilitation services, and trained personnel who can support people with different types of impairments during and after emergencies. For example, in the Solomon Islands, participants pointed out the need for facilities and services specifically designed for individuals with psychosocial disabilities, including safe spaces where they can receive care and support during crisis. And the quotes on the slide also illustrate that people are thinking not only about immediate survival, but about longer-term recovery and independence. And some participants spoke about using financial support to restart small businesses, while others emphasized the importance of access to medical care and treatment. Next slide. And another important dimension that emerged from the interviews is geographic inequality in access to support. So participants explained that persons with disabilities living on outer islands or in remote areas often face an additional layer of exclusion. So compared to those living on the mainland, they may have to wait significantly longer for assistance, services, or assessment after disasters. And the quote on the slide illustrates this clearly. So in contrast, people closer to mainland areas may at least have neighbors or nearby communities who can provide some immediate assistance, which is often not the case in more isolated locations. Next slide. So this slide brings together the different findings we've discussed and visualizes them as layers of exclusion that shape disaster vulnerability for persons with disabilities. As mentioned at the beginning, disasters do not affect everyone equally. So persons with disabilities often face compounded risks because multiple barriers interact with one another. So at the outer layer, we see societal and structural barriers such as inaccessible infrastructure, limited access to education and training, and social exclusion. And these barriers can limit meaningful participation in society. And these structural challenges often translate into economic and financial exclusion, where many persons with disabilities face difficulties accessing stable employment or reliable sources of income, and even financial services, including insurance. And another layer relates to information and communication gaps, which we saw in the findings. So many disaster communication systems are not designed with accessibility in mind, meaning that persons with disabilities may not receive early warnings or critical information in formats which they can use. So when these layers come together, they create what we describe as a resilience gap, where persons with disabilities significantly face higher risks during disasters. And in this context, insurance plays a very specific but important role. While it cannot address all of these barriers, it can help reduce economic vulnerability by providing rapid financial support after disasters. So in doing so, it contributes to closing part of the resilience gap. In the interest of time, I'll skip the final slide, which reinforces these points by situating insurance within a multi-actor inclusive framework, highlighting that inclusive resilience is built through coordinated action across multiple sectors. So the framework emphasizes that insurance is an important component, but it works most effectively when embedded within a broader ecosystem of inclusive policies, services, and support systems that protect persons with disabilities before, during, and after disasters. With that, I will hand back to Sharon so we can hear from our implementing partners in the Pacific. Thank you.
Thank you, Dr. Stella, for that very informative presentation and for highlighting some of the challenges in terms of accessing insurance, but also some of the opportunities for strengthening inclusive climate risk insurance. Colleagues, just note, if you have any burning questions for Dr. Stella, please feel free to put that in the chat box and we will respond as we continue. Now, I would like to invite Ms. Tepola Rambuli from the Pacific Disability Forum to share some reflections from an implementing partner's perspective. PCAP has worked very closely with the Pacific Disability Forum over the years, ensuring that we are meaningfully including the perspectives and the voices of PWDs in terms of design, in terms of pricing and affordability, and accessibility. Just a brief intro on Tepola. Tepola is the regional coordinator for the AHP Disaster Ready 2.0 Plus project at PDF. Her work mainly focuses on disability inclusion in DRR and CCA in partnerships with the OPDs. She has been working in the CSO sector for more than 10 years on DRR and climate change issues at the regional, national, and community level. She joined PDF in 2022, expanding her work in DRR and climate change with a strong focus on disability, advocating for the rights, needs, and challenges of PWDs during disasters. And with that said, Tepola, over to you. Thanks.
Thank you, Sharon, for the introduction. And Muluvinaka and Ruinaka to all our viewers and our participants joining in on the virtual platform. And it's an honor and a great opportunity to be invited to speak on this platform on behalf of the 1.7 million persons with disability across the region. Having said that, I'm not a person with disability, but as introduced earlier, I've been working in the sector since 2022, and it's an honor to be here, to be advocating on the rights, to be speaking on the needs, and also to be highlighting the challenges faced by our members, not only in Fiji, but across the regions, on the disability inclusion in DRR and the challenges they face in terms of preparedness and response and recovery in disaster. And not only that, and also on the issue of climate change adaptations. I'll be sharing very briefly the work that the Secretariat has been conducting for over 3 years now, since 2023, on parametric insurance. And it was a privilege to be working with our development partners in the sector, the UNCDF, UNDP, and also with our national OPDs. To be able to implement this initiative on parametric insurance, and with that, and also the support from the PDF team and the PDF Secretariat in carrying out this initiative, looking at the needs of persons with disability, the work that has been done around humanitarian response, and what were the gaps that we need to take this initiative forward to be able to address the needs of persons with disability. So we took on the project in 2023, a pilot project, and partnered with the NCDF at the time, the United Nations Capital Development Fund. And we implemented the project in 3 countries, in Fiji, in Vanuatu, and in Tonga. In Fiji, we conducted awareness and registrations of our members, and also onboarding onto the iOnboard platform to be part of this parametric insurance scheme. However, while we did the same process in Tonga, it didn't go further than the registrations. It stopped because of the structures in place in terms of the insurance presence in country in Tonga and Vanuatu. But very briefly, I would like to just highlight some of the successes and also the challenges that we find when we were implementing the projects, and also maybe the opportunities that came about throughout this process. While we were implementing the project here in Fiji, we managed to onboard 700, more than 700 of our members from 9 provinces in Fiji, and onboarded only 600 plus. I will explain on the challenges of why the numbers have decreased from 700 to 600 from the registrations to the onboarding. And then the flood that happened in 2024, we managed to do the payout for 202 of our members. That for us is a success story in terms of persons with disability receiving payment straight to their mobile wallet or bank accounts to be able to take care of their needs. And as we mentioned, the parametric insurance is designed in such a way that is triggered by an event or a hazard or a disaster in the country. In Fiji, it was the rain and the wind, but because of the amount of rainfall, persons with disability will receive the payout. Having said that, while the payout was being dispersed to our members, there were also gaps that we identify in terms of the payout. Like I've mentioned, the registration of our members from 700, and it was reduced to 600 because of onboarding. This was because of most of our members do not have a valid photo ID. And because of the terms and conditions are being highlighted in the parametric insurance of what a person might need to be able to register, most of our members do not have this, especially the valid photo ID that a person should have to be able to register for not only parametric insurance, but for anything that you wanted to register for. And this was some of the challenges that we find with our members at the national level and the local level. Hence the numbers that has decreased from the 700 to 600. It is something that we highlighted as part of our feedbacks in terms of the implementation that we have done in Fiji. There were also challenges in the product that were being rolled out at the time. Like I said, this was a pilot project. In terms of the accessibility and the information shared about the product, the technicality component of it, where most of our members would not understand what the parametric insurance is about. And I believe Dr. Stella has also mentioned that in the findings because of the research that they have conducted in the 3 countries. This was some of the things that we highlighted in our feedback. How would we be able to take the information about a product that is being developed and explain it to our members with different impairments across the disability sector? How would we be able to explain to the deaf, to explain to the blind that it will be put in braille of something that is really technical in like a parametric insurance product, and go down to the community level and be able to explain. And then is also comes to a payout where our members would not be able to understand the terms and conditions. Why some of our members were receiving the payout and some of our members would not receive the payout while they were living maybe how many kilometers apart from each other. And these were the information that needs to be simplified for our members within the disability sector, for them to be able to understand the content of the parametric insurance and how it has been designed and developed. But while at the same time we are trying to address the needs of persons with disability, there were still some gaps in terms of our implementation. And then we had also the opportunities that came about while we were rolling out, and then we realized the premium payment that needed to be paid by persons with disabilities. There are the percentage of our members that we're living below the poverty line in terms of the sources of income. And while most of them are under the disability allowance scheme, there are also countries in the Pacific that do not have that assistance. So how would a person with disability be able to pay for premium payment of parametric insurance when we were looking at the source of income that a person earns within a year, and how would you be able for them to pay for a parametric insurance that you wouldn't know whether you will receive a payment of it? It just depends on the weather triggers that might happen or might not happen within a 12-month period. And those were some of the gaps we were looking at and highlighting it throughout the implementation of the project. We were very fortunate that into the second phase of the project that Reserve Bank has come on board. And also in the first phase that UNCDF paid for the premium of the more than the 600 members that we onboarded. Now moving forward on the sustainability component of the project, how would we be able to sustain our members to be able to be part of this parametric insurance scheme if you're going to continue? And these were the opportunities that we were looking at in terms of our partners with our stakeholders at the national level, not only in Fiji, but how we'll be able to replicate that in the Pacific Island countries. Now that Reserve Bank of Fiji has come on board on the second phase to be the focal point of the project of the parametric insurance with our national stakeholders, but how will we be able to replicate that moving into other Pacific Island countries? While we have addressed the challenges in terms of the parametric insurance, we haven't really gone to the extent to be able to identify the different needs and what would the product look like if you were going to take in on board what the needs of persons with disability are, what terms of preparedness we would need to take in order to be able to roll out the parametric insurance payout, that we ensure that we reach our members on time. And also at the same time, how would we be able to sustain this project moving forward in terms of the premium payment of our members when we were looking at the broader landscape of how would we be able to continue this. And those are some of the things that we have identified. But at the same time, we were fortunate, and it's a privilege to work with our partners who've come up with initiatives and how we'll be able to expand this. And I think one of the opportunities that we have embarked on is the partnership we have with the Reserve Bank, but also at the same time to be able to expand this in a more of a generation income activities for persons with disability if you're going to partner with financial institutions, not only with Fiji, but also in other Pacific Island countries. And also expand on what are the needs of persons with disabilities on the ground, moving to other Pacific Island countries who don't have disability allowance scheme. Other countries that the level of partnership with a financial institution is still not up to par in terms of the work around economic empowerment and this income generations work that if you're going to roll out this parametric insurance across the other Pacific Island countries. And those are some of the challenges and the gaps and the opportunities that we have come across while implementing this project, and we will continue to implement, just highlighting on the needs of our members, the accessibility component of the product, the way that we roll out the awareness, the needs of our members, and also some of the things that is not still in place in terms of infrastructures and service that affect the implementation of the parametric insurance here in Fiji and across the Pacific Island countries. Maybe Sharon, that is just very briefly on the work that the PDF Secretariat is currently conducting in the implementation of the parametric insurance in Fiji and across the different Pacific Island countries that we are working in.
Yeah, thanks so much to Paula for firstly highlighting some of the success stories, including the role of premium support to addressing some of the affordability concerns, but also your candidness in talking about some of the challenges in implementation. I think while it's great that we have, success stories, I think it's also important that we highlight some of the challenges so that we can take a look at, strengthening our approaches. And then I think this platform provides an ideal opportunity for practitioners, experts, the OPDs, and other colleagues to sort of, start brainstorming and start sharing ideas for further discussions for the future to come. So the next speaker I have is someone who is well known in the disability space, but in particular the Kingdom of Tonga. It is my pleasure to introduce Mr. Rima Misa. Rima is the director of Lava Mea Tai Loa Disabled People Association Incorporated, or shortly referred to as LATA. And he has been a strong advocate for persons with disabilities, championing the rights of PWDs and the inclusion of PWDs across various thematic areas in Tonga. So Rima, if you're on the call, over to you. Thanks.
Thank you, Sharon. I think first of all, I just want to apologizing for coming late due to the internet connections, because I'm currently out in Hawaii Islands doing our training on leadership, part of our capacity buildings of our team on the other islands. But anyway, thank you so much and appreciate for the opportunity that given by the UNDP and the team and all of you for me to speak on behalf of people with disabilities. I think in regards to the pandemic insurance that Tepola already mentioned a lot of what we have been working on. But I think one of the things that I just kind of really emphasizing here in Tonga, this is one of the challenging that we are facing. It's lack of awareness raising regarding to the paramedic insurance scheme, and not only that, but I think almost 98% of people with disability here are still based on the charity models, and this is what we are actually working really hard on it to see how they can realize the paradigm shift to move from charity models to human rights approach. They and that is the I think what I can say. We need a little bit more on awareness raising regarding the paramedic insurance, as well as a little bit more training our people to shift, to realize the realization, the shift, the paradigm shift. We are no longer based on charity or medical models, but we are moving on to human rights approach. So and I think with that, I think we have to start not only from us OBD. As I know, I've done the disability movement started from way back in 2003 up until today. We are still hanging on charity models started from our government. But I think it is a privilege just for me to share. Like I said, that the previous speakers, they were touching a lot about the paramedic insurance, and also my partner from PDF. Appreciate a lot for all the inputs and the support from their team in order for us to actually going on and keep on going, even though it's a lot of challenges that we are facing with. But we appreciate the support from the partners and also the UNDP. For me, I just want to highlight a couple of things that we need to do a little bit more of awareness raising and make it more a little bit accessibilities. As you know, that the product sometimes are not accessible, especially for visual impairments here and the deaf. That are the most challenging people here because none of us here are access to, to sign language, or even qualify, or even for the visual impairments. I think by my comment on that, if we kind of really work on the area of awareness raising, but make the product to be more accessible, especially for visual impairments and tests, because none of us here qualify in Braille as well as sign language interpreter. But I think that is one of the things that I want to highlight. Binaka, Malo Seron. Hello.
Thank you so much, Rima. Thank you so much, Rima, for your reflections. And I think to some extent, many of the UODs across the Pacific can resonate with what you have shared, and definitely agree on the awareness bit. I think more needs to be done. And when we're looking at persons with disabilities, we need to be looking at how accessible information is available, and this needs to be done in Braille, in sign language, and catering to the diverse needs of persons with disabilities. So thank you so much, Rima, for joining us despite your busy schedule. Next on our agenda item is a video, testimonial video by Mr. Semiti, and I would request Linda, if you could please start sharing the video. Thanks so much.
I've been through some of the succulent seasons before. When it hit, I was not aware. And when it happens, I can feel the atmosphere is not good there. For me, a blind person, when this thing happens, it's different. Because you can see where to run. Some of the succulent season I've been through, especially the category 5-1, the wind standing, I was not aware. I was in the village, in one empty house. And when I woke up, the wind was so strong. It was running at that speed. And one of my friends, lying on the bed, was asking me, what you gonna do if this trophy are gonna go? So I moved myself close to the door and I told him, I'll go into the house. And the feeling that time is different altogether. From the first thing comes into my mind is the structure of my house, how safe it is, or what can I do if something happens, especially being blind. This is the first time I ever heard of this, and I was glad to be part of it. Being aware that we can get assistance from it, and it makes me feel good, feel safe, feel that I can get something out from the disaster or whatever happens in the area where I will be living in. Even if my house don't get blown away or the area will be affected, and still I can have something to bring about my safety, to buy some things for so that I can go along with my everyday life like other people do it. And this is a great help to me.
So I think this testimonial video is a great reminder that behind climate risk insurance solutions and other financial tools, there are real people with real experiences, and it's great that this video was developed by Pacific Disability Forum, and we thank them for taking the time to speak to Mr. Simiti about his experiences. So I think Now we'll move into our moderated discussion with our speakers, and I think we're a bit pressed for time, but Linda, if you could move on to the next slide, please. So we do have 4 questions that we would like to pose to the panel, but participants, if you have any response to these questions, please feel free to also put that in the chat. So the first question is, what product design features are most critical for accessibility and affordability? And I think I will hand the mic to Mr. Paula to respond to this. So Paula, over to you for your response. Thanks.
Thank you, Sharon. And thank you for the questions. In terms of the product that has been rolled out ever since the parametric insurance project came to be, and like I've shared with other speakers that have spoken earlier, the accessibility component comes into play for our members. The different impairments, the different needs within the disability sector will require that the product is simplified into a language or into a simple format for our members to be able to understand. The lack of knowledge on the understanding of the product will lead also to the reluctancy of our members trying to be registered, for them to be registered or onboarded on this platform. I've mentioned earlier the technicality aspect of the product and how it is the weather triggered in the different countries. Sometimes it's really hard for us to be able to explain what the parametric insurance initiative is all about. The way the product has been designed is for our members or the affected populations affected during disaster to be able to receive assistance before the national humanitarian partners come in and conduct the response assistance, something that they'll be able to access soon after the disaster, to be able for them to get what they really need in terms of food, the assistive device, and medicine or medical supplies. While the initiative is good, the product, the way it has been designed is not accessible for our members to understand. We're talking about the blind in terms of, for those who are born blind, who would not be able to understand when you're talking about a product and talking about weather triggers, and something that has to be simplified to our deaf members across the region. Rima has mentioned the lack of awareness at national level, the lack of infrastructures that is in place to be able to support this work. There are no sign language interpreter in Tonga. So how would we be able to take this product and explain to the deaf community in Tonga that what the parametric insurance is all about? While we are rolling out the product, we realize the gaps at the national level and local level in terms of infrastructure. So accessibility component of the project in terms of how would we be able to simplify it for our members to understand what the project is about. And while we're talking about the accessibility component, we're also looking at the premium payment of the product, something that I've also explained earlier. How would our members be able to continue pay for a premium for those who do not even qualify under an employment scheme or are not earning any constant source of income? And you look at Vanuatu, who do not have a disability allowance scheme at the national level. But then in Fiji, you have persons with disability receiving allowance per month, the $100 and something that comes into the account. Would they be able to pay for premium payment per year, given the other needs of a person with disability they need to cater within the disability allowance that they've been given? While we are very fortunate that this has come into this has come about in terms of parametric insurance being rolled out, it also exposed some of the infrastructures and the service providers at the national level that need to be able for us to support this work and be able to roll it out. We're looking at the accessibility component. While we're looking at accessibility component of the product, we're also looking at how would they be able for our members to be able to receive this payout, given that the mode of payment is only through the mobile wallet and bank accounts. One of the challenges that we found out when we were doing registrations that most of our members do not have mobile phones and smartphones, if I may call it, and no bank accounts. And these are only the two mode of payment where you can receive this product if there's actually going to be a payout. So these are some of the challenges that we found for our members that we highlighted. How would we be able, if there was another way to conduct payout of the product? And also the terms and conditions that comes with it. I highlighted the issue of national ID. While we were conducting awareness, we realized that most of our members do not have a formal ID. For our members in the psychosocial community, national voter ID is something most of them do not have. So now how would we be able to work with stakeholders at the national level that every person with disability has a national ID that will require them for them to be able to be part of the parametric insurance product? And these were some of the things that came about when we're talking about accessibility. While the product has been developed and been designed, one of the things we're looking at if the product, the design of the product to have persons with disability within that consultations and development phase, the OPDs and representative organizations at the national level, for them to be able to inform what are some of the accessibility components when we're rolling out, instead of taking the product to the communities. And then we realize that the way the product has been designed would not be able to explain for our members in the disability sector for them to understand. Like I said, it has a lot of technical component to it. And while we are happy to partner with our national stakeholders, but it also exposes a lot of vulnerabilities in terms of infrastructure that's already in place that's supposed to support this work when we roll out the implementation at the national and the local level. I've also spoken about the affordability component of it. And we are very fortunate in Fiji to partner with Reserve Bank. I've mentioned in my earlier discussions with some of the partners that this was a very hard nut to crack in the disability sector, partner with finance institutions. And we wanted to replicate the same work in other Pacific Island countries where Reserve Bank is taking the lead in the work around parametric insurance, that other financial institutions will be able to come on board and partner with us in order for us to be able to maybe just strengthen some of the work around the economic empowerment and the gaps that have been there for ages for our members, not only in Fiji, but across the Pacific Island countries. I think, Sharon, I'll stop there for the next question. Thank you.
Thanks, Topola, for that elaborate explanation and response. I think question 2 is also directed to you. How can insurance be integrated with evacuation and preparedness systems? So if you could please provide maybe 30 seconds to a minute response to this question so we can have other panel speakers respond to the third and fourth questions. Thank you.
Thank you, Sharon. Very briefly and very quickly, in terms of evacuation and preparedness. And we know the parametric insurance is designed in such a way that the payment is rolled out after a disaster hit. And while we're looking at the needs of our members on the ground in terms of disaster preparedness and response, how would we be able to develop a product that will roll out the payment before a disaster do strike, when the early warning information is already being disseminated, where persons with disability will be able to use the funds or the payout to prepare things for a disaster before it strikes. And also, as part of evacuations, how would we be able to use this scheme, this assistance, this parametric insurance that has been rolled out? Because when we collect data disability. On the ground, we have data of persons with disability, the age, the different impairment, the locations, which is something, the information that we collected. How would we be able to use the same information on this platform as part of evacuation and work with some of the structure that's already present at the community level, like the Community Disaster Management Committee, working with the provincial office and the NDMO to identify persons with disability in the different areas where they are located, to be able to be part of the evacuation as they move persons with disability from where they reside to evacuation centers, but being paid out by the parametric insurance and ensuring that transport is made accessible. The people or the first respondents working within these sectors knows how to work with persons with disability, which means they would know how to work with the blind or how to work with those with physical impairment in terms of moving our members from where they actually reside to evacuation centers. But move the parametric insurance as a response mechanism after disaster to be part of the evacuation and preparedness before disaster. And that's something that we have discussed here at the Secretariat, to be able to just develop parametric insurance in such a way that it's part of preparedness and evacuation phase, instead of rolling it out after a disaster to be part of a response assistance scheme. I think I'll stop there, Sharon, to give time for the other panelists. Thank you.
Thanks so much, Paula. I think because we're pressed for time, we're just going to go through this very quickly. So maybe the third question, perhaps Rosia, you could respond to this from government's perspective. Over to you, Rosia. Thank you.
Thank you, Sharon. Very quickly, government and all partners play a very critical role in this. And I know all speakers have said a lot about this as well, so I'm going to summarize it very quickly in 5 points. First one, inclusion at all levels, consultation, program design, even if it means creating supporting policies, awareness, using the right, or I would say appropriate tools and resources. That would also include, simplified language, like Tepola has mentioned, sign language as well, and at all stages up to the implementation. Secondly, in terms of investing in systems like social protection, which looks at the life cycle approach and integrate insurance and disaster risk management strategies into it. More like I'm saying, consider adaptive social protection approach. Thirdly, if there is a pilot project, it requires an impact assessment, a thorough impact assessment that would address all the concerns, very well, highlighted by Tepola on that, the challenges that they're facing. This needs to be included in the reports and also addressed accordingly, and also advising on the way forward. The fourth one, I would say, is in terms of subsidizing the excess, which could also mean premiums as well. And finally, regional and international consultations to learn from the best practices and also to support as a collaborative approach to these inclusive solutions. Vinaka.
Thanks so much, Rosia. And I think the final question, I will leave it to Rima to respond to. How can trust in insurance be strengthened? Rima, for your 30-second, 1-minute remarks. Thank you.
I think I can highlight it on two things. Very important to have the definitions of inclusion. What do you mean by that? And not only that, but the fully effective participations of persons with disability meaningfully in every aspect. Vinaka.
Amazing. Thanks, Rima. So now we will go on to the next slide. I believe it's Q&A, but I see that some questions have already been posed in the chat box, and I see some of the colleagues have been responding to that simultaneously. Because we're 1 minute over time, we do apologize that we won't be able to respond to your questions right now, but we have been taking notes of the individuals that have been posing the questions in the chat box, and we will follow up accordingly after this webinar. So with that said, we come to the end of our webinar, and I would like to begin by expressing my sincere gratitude to the wonderful speakers, Senior, Rosia, Stella, Tepola, and Rima, for generously sharing your time, your expertise, and your perspectives. Special thank you to the beneficiary who shared his video, Mr. Semiti. I would also like to acknowledge and thank our donors, the governments of New Zealand, Australia, Luxembourg, the United Kingdom's Foreign, Commonwealth and Development Office, and the Asian Development Bank, whose continued support enables initiatives like PCAP to explore innovative and inclusive approaches to climate and disaster risk finance and insurance across the region. Finally, thank you to everyone who joined today, colleagues from governments, development partners, organizations of persons with disabilities, practitioners across the Pacific. Your participation and engagement is critical to ensuring that we design for financial protection mechanisms that truly leave no one behind. We hope today's discussion has provided useful insights and strengthened our shared resolve to making climate risk insurance and disaster resilience efforts more inclusive and accessible. Once again, we apologize that we haven't responded to some of your questions, but again, once the webinar ends, the chat box will remain open for another 5 minutes, so please feel free to continue to put your questions in the chat box or your comments, and we will be sure to respond to them afterwards. Thank you all, and have a great day, evening. Vinaka.